in 2017, my mother came to live with us all of a sudden. She went from living independently in Spearfish to having her neighbor call me and say, Susan, it's time for you to come get your mom. She's not doing well. And she went from living independently to almost overnight needing to have 24/7 care. And I was still trying to work full time, as Kirsty knows, and I didn't actually work full time. I used a lot of vacation, sick leave for the next year. But Stella I worked for the hub at that time, and she was responsible for all the caregiver services. So I used the day break at the hub, which is an adult daycare. And I went to a support group that Stella was leading there. And that was where I really learned from other caregivers how to be a caregiver. And so Stella retired from the hub several years ago. I still had her phone number. So as my husband needed more care, I knew Stella knew where the resources were. So when I thought that we should start a ministry here at the church for caregivers, I just felt I should call Stella, and I thought, no, Stella's busy. And so I finally called Stella. She said, oh, that's exactly what I want to do. I'm the new president of the AARP advisory board for the state. And she wanted her platform to be about caregiving. And so we met at Java Moon. We put together a list of subjects. We then got Jeff together and we changed him a little bit. And we started this program last year. And Stella has just really been the dynamo behind what we're doing. So tonight, Stella is going to talk about the caregiver's role. And she will introduce Clarence later.
You can all hear me there? Okay. So Cherish asked me, are you going to run around? I said, nope, I'm just going to stand here. I'm just not one to stand at a podium. So I do love what I do. I do love what I did at the Senior Center as the Director of Family Caregiver Services. I met a lot of you there. I see some of you here in the audience. Some of us weren't caregivers at the time. I know some of you from the hospital. I worked there 12 years before I went to the Senior Center and worked there with caregivers. I didn't know I was going to be a caregiver, and I'm going to talk a little bit about that because most of us don't raise our hands and say, I think I want to be a caregiver. We don't know when that's going to happen. Like Susan said, she got the call, her mom needed help. We were long distance caregivers. My parents lived in Utah. And we lived here, our son, we still had a son in school, in high school. And my mom was really going into dementia. But I only saw them a couple times a year or when they came here. And one time when they came here and my dad did his caring at the VA, we were walking into the VA when my dad said, you know, I think I have a hernia. And I'm not clinical, so I thought, oh my gosh, what? I said, why do you think you have that? He said, well, every time I stand up, this thing kind of comes out. And so we went into his appointment and I told the doctor, well, when they would examine him and he was laying flat, the hernia was not visible or not palpable. When he stood up, that's what was happening. And he was caregiving so much that he was doing a lot of caregiving. And so the doctor there sent him to a surgeon in town, Dr. Gould, who said, if you're a caregiver and that hernia twists and you live in a very rural area, which they did in Utah, you could be gone in a couple of hours and you wouldn't be a caregiver. You need to have surgery now. So here they were visiting us. He had surgery. And what we realized was that my mom was really far into her dementia. Really far into her dementia. So we took them home with the thought of, you need to come back and be here. We can't leave our jobs and school and all of that. And so we found a home, bought a home about a mile from us and moved them here. And we were caregivers. But see how we didn't raise our hand to be caregivers? And I think all of you are going to, I think you all know that. There could be 5 of you in a family, 5 siblings, and not all 5 are doing the same thing. That's just the way it is. So my I kind of wrote out some notes because I tend to just go off on different tangents. So it's not that I need to read my notes, but I need to stay on track. So I just wanted to welcome you all, and I thank you. I see some familiar faces from last year, and I see a lot of new faces, and I've met some new people, and I appreciate your stories that you share. And I know we're all here because the one thing that brings us here is caregiving. Who is a caregiver? Sometimes you think, oh, it's an adult child. Well, an adult child can be 60, right? Their parents could be 80 or 90, but you're still that adult child. You're still their child, and you still remember what you were taught to respect your parents. So it's really hard to have that role reversal, which is a whole different subject. But when you reverse that role and you're now in the caregiver role to your parents, it's just it's not what you thought it was going to be. But you can be a caregiver to friends, to relatives, to grandparents, to aunts, to adopted family. My husband and I, we'll hear our story a little later. We are currently caregivers to some very good friends. They don't have family, and they're in their late 80s, and we're now caregivers to them. So I thought that I would share some tips that I think we all know these tips, but when it comes to you, you're not thinking that I need to practice this. It doesn't quite apply to you, but they need to apply to you, to every one of us. So my first tip is self-care is essential. Caregivers often prioritize the needs of others before themselves. We agree? Yes. It's really vital to take care of ourselves. In order to be a good caregiver, we have to care for ourselves first. A little bit, I mean, if you have a hobby, and I'm just going to use an example of myself before I was a caregiver and before we moved my parents here. I had been playing the game of bunco before we moved here in 1994. So I've been playing this game of bunco now almost 40 years. Every Tuesday, or second Tuesday of the month. Well, maybe I shouldn't go because I'm a caregiver. They probably need me on Tuesday. I needed that one Tuesday with my 12 other friends, and I really needed that. But you have to tell yourself that, or else you can find an excuse to not do what you need to do for you because your loved one always needs something. You can always find something to do for them. So really take care of that. Prioritize and don't let some of the things that you love go, whether it's reading a book quietly or whatever it is. Communication is key. I believe that communication with your loved one is really key. Sometimes when people are moving into cognitive decline, it's really hard to have a conversation, and we all kind of know that. Sometimes there's just a word or two that you need to use to help them. They're sitting in a chair. It's not, hi, I made dinner for you. It's time for dinner. Are you ready for dinner? I made your favorite. We're going to have spaghetti. They didn't hear that. Just say, can you stand up? Come with me. And we go to dinner. They're going to get everything you just would have said. We're going to have spaghetti. We have your favorite. We have all of this. A caregiver in support group once told me with his wife who had Alzheimer's. He said, you don't say, would you like chocolate or vanilla ice cream? You say, here's your ice cream. And that's the communication that you might need at that time for that person. Not everybody is supporting or being a caregiver to someone with dementia, but if you are, those lines of communication are really important, even if it's just a few words. The other lines of communication are with the healthcare. When you're in the office with your loved one, and it's really important that you share. When you get in there and they'll say, well, Mrs. Smith, how are you today? What brings you here? I don't know. She wanted me to come, right? They don't know why they're there. So if you need to write a note prior to that appointment, because these are things that are happening, send that to your caregiver. I'm doing that right now with the help of the wife of the person that we're helping to care for. And we send that to the doctor. And when the doctor comes in, he already knows what's going on at home. We're not saying that and saying things in front of the loved one and making them feel bad, like, no, I don't do that. So really, communication with your healthcare providers is really, really important. Set realistic expectations. So caregivers should set achievable goals for themselves and for the person they care for. And it's okay to acknowledge that some things are beyond your control. Let's just for a minute think of what's coming up. It's now September. What's already on the stores? Christmas, right? Thanksgiving. What are your goals? Are your goals oh gosh, the neighbors, they decorate their whole house. They put all those lights up and my loved one can't do that anymore, but maybe I better hire someone to do that. And all this stress of needing to do things that maybe are not a priority anymore. Maybe that's not what you need to do. So set things that are realistic expectations, because if you don't, you will feel bad and you will feel guilty. And that's the last thing you need. You already feel guilty for whatever it is. And we always used to joke in support group, well, if you're Catholic, you're supposed to feel guilty because that's what we do. Here we are, holy name, but really do set those expectations and acknowledge that some things are beyond your control and you can let them go. And maybe this year you don't have to have the same thing you did last year. Maybe that Thanksgiving dinner that you always go to your brothers or wherever, or there's kids and grandkids and great grandkids and nieces and nephews. How is that for your loved one? Is that confusing? Is it maybe easier to go after and maybe go for dessert for a little while and maybe bring home that meal? Sometimes they don't know that today is that day that you're supposed to have turkey. So don't set yourself up for those, expectations and then they can't happen. Staying organized. That's a really good one. Keeping track of appointments, medications, and daily tasks will help you with your stress. I still like to write mine in a day planner. I'd like to look at that day planner and say, oh, at 9 I do this, at 11 I do this, at 4 I do this. Some people put it in their phone. My husband puts it in his phone. I'm like, how do you see that? I mean, I see texts and emails and all of that. I don't know that I could see that, but that's me. So there's all kinds of things that help you to stay organized, whether it's paper or it's more technology based. Do what works for you. Even a pill box, the pill box that has your AM and PM pills, the people we are caring for. We brought her home from the hospital. She was there for 21 days between the hospital and the transitional care unit. And we got home and we stopped and got her prescriptions, and they were at least 12 bottles. She had never used a pill holder. She opened that bottle, I don't know how many times a day. If one bottle takes morning and night, if one bottle takes them 3 times, she was doing that many times all day long. That to me, as a caregiver, I had to do that to help her. So then we did that to help her husband, to help her. You see what I'm saying? How that kept her a little bit more organized. She spent her entire day figuring out what pills she needed to take. Educate yourself, understanding the condition, the person being cared for, including symptoms and progression of the disease, helping to better provide and manage your expectations or what they should be doing. You think you can be this caregiver, again, when you're caring for your parents and you're trying to tell them what to do with that role reversal, sometimes it's not so easy. But what about if you're even a caregiver that's a CNA, let's say in a working for another company, and you're sent out to go see this family. And wow, your appointment's at 4 o'clock, and that person just is not in a very good mood by about that time. If they don't know that the word sundowning for people with dementia is something that changes their moods, their personalities, they might want to go home, and they are home. Those are all things that if you're educating yourself on what it is that you're dealing with, it's going to be easier on the caregiver. So as much as you can. Establishing boundaries. It's important to set limits to prevent burnout. Know when to say no and when to ask for help. Here's where I thought I'd tell you a little story about myself as a caregiver with my mom. Once we moved in here, was it easier? Kind of, because I knew what was going on. Kind of not, because I saw everything that was going on. And sometimes I was telling a friend from who you'll meet, Esther. She cherished when Esther will be here during the caregiver series. And Esther's a caregiver to her family members right now. And so we were visiting. And as I told her this story today, I got very emotional. And then I caught myself and I said, I don't think that I'm emotional. It's been like over 10 years. But I was telling her the story of just that, knowing when to say no and when to ask for help. Well, I was going early in the morning to try to get my mom up because my dad couldn't get her up. She'd fold her arms and cross her legs and she wasn't going to get up. And you couldn't just say, come on, Mom, get up, it's time. It was everything was in a word or 2 words. We would just do that, 1 or 2 words. So I didn't think anybody else could do it. When I gave them that chance, there were wonderful people from the senior center that came and provided that support. They would get my mom up, get her to the bathroom, get her dressed, get her ready for the bus to come from the senior center, to pick her up, to take her to daybreak at the senior center, where she'd stay all day, had breakfast, had lunch. And you know what? That helped me tremendously. I didn't feel like I was late to work every day, not making a meeting. And somebody else could do it. But I was so much, they have to have me. My dad, we had, Clarence used to mow their lawn. I did pretty much all the housekeeping and our housekeeping, their housekeeping. And, we wear down as caregivers, don't we? So the senior center had a program, and it was, they helped with snow removal. They helped with lawn care, and Clarence would load that lawnmower every week and unload it and, back and forth. And so when that was available, I was so excited. And I told my dad, I said, guess what, Dad? I said, you know how Clarence has been doing your lawn? And I said, there's a program at the senior center. And I said, they only charge you $3 for each time that they do it. And my dad looked at me and he said, well, Clarence does it for free. He didn't know whether to laugh or not. It wasn't funny because I knew what Clarence went through. I'm like, I'll just pay the $3 and I'm not going to say anything else. Well, next thing we know, my dad was friends with they were called the 2 guys. So he was friends with both the guys, giving them tomatoes. And guess what? That was more socialization for him than Clarence and I who he saw every day. So all that just worked out. All that worked out. So know and establish your boundaries and to prevent burnout and ask for help. Don't not ask for help. I haven't seen anybody come out of that respite room yet. So everybody's having a good time. So you might enjoy an hour or not, but at least you're sitting out here. You're not having to do caregiving for 1 hour, right? Utilize your resources. Encourage caregivers to explore local resources, support groups, and respite care options. You don't have to go at it alone, just like we're talking about. In your bags, there's a little resource guide, little AARP resource guide. There's a lot in this guide. So take a look at it. But there's also a lot of local resources. As I talked about, the senior center has a lot of services. Talk to them to see what it is that they might offer. Support groups are a wonderful thing for people to attend. There's online support groups if you feel like you can't get away, but there's also the support group that you can get away and go to a support group at the hub. If I don't know what time they have. I did it for 13 years at 10 o'clock and 5 o'clock on a Monday, but and some of you in this room were in my support group, as Susan said. But to check into that. I had 2 calls this week for resources, and I'm just going to share this. One person called me and said that they were needing some help for their mom who fell and broke her hip. And when she got out of the hospital, they would like something like that button. Help me, I've fallen and I can't get up. For us, it's called LifeLink. That's the local one here. There's a lot of different options all over the country. Some people use an iPhone and help, but whatever it is, it's something that's peace of mind for the caregiver. If you're leaving, if you're just going to the store and you just tell this person, now you just stay right here because I'll be right back. I believe my mom was going to stay right there. The senior center didn't believe my mom was going to stay right there. So we couldn't just go off and leave her and say, well, you can just come half an hour after I leave. You don't know what your person's going to do. And if they get up and they fall and they have to lay there, or they go out to see who was at the door and it's wintertime and they fall out there, we know people that have taken falls outside and have laid there for a while. Somebody just told me a story the other day that their loved one laid in the snow for 2 hours. It's probably the cold helped the bleeding and they didn't die. But that's not what you want. But this person needed LifeLink. They needed, when their mom comes home, they needed something, this LifeLink button to help her be home, and peace of mind for the loved one and good for the caregiver. So we have it already set up that when she gets out of the hospital, we will have a local installer and a volunteer that will go with them, and they'll install that button for her to have. So it will detect a fall if she falls and she's alone. So that's one. The other one, I got a call was from somebody that was looking for help for a parent who was low vision. And there's an organization in town called Wyoming Independent Living. They offer a lot of services. When we brought our little friend home from the hospital after 21 days, and she's 89, she decided she wasn't going to drive anymore. She still has doctor's appointments. She still has hair appointments and going to the grocery store and all of this. And she wasn't sure if she could afford to call the minibus every time she wanted to go do one of the, an appointment or just go somewhere. So I called Wyoming Independent Living, and I even called them before she got out of the hospital. They came and saw her at the hospital. We talked about the needs. They helped with what do you need for home modifications? What do you need for like the shower or those kinds of things? Wyoming Independent Living is local here in Sheridan. And so know your resources. There's a lot of them. And I have cards back there. If there's something that I can help you with or answer questions, feel free to, I will try to help you. Foster emotional connection. So building a strong emotional bond with the person you care for in the long run, whether it's a friend or a family member, it's much easier than if you are at odds, right? We can feel when somebody doesn't really want to do something for us or with us. So the more you can establish that bond, or if you have somebody coming into your home, a CNA or housekeeping or somebody, make sure that that's being established. If you feel that that's not working, call that company and say, you know what, this isn't working. Is there somebody else that I once had this is a funny story. The gentleman needed help for his wife. So we had a caregiver and she was very nice. She was very social. And so the caregiver, the gentleman came and said, Stella, he said, do you have anyone that's a little less social? They couldn't take that much talking. They weren't used to talking that much. And this person wanted to keep this lady company because she was so quiet. She thought she was just isolated, but really that's what they did. And so, you know, we found somebody else and she stayed until this person passed away, and they asked her to stay during the passing. That's how much they bonded. So you just need to find that right person. Okay, two more here, and then I'll share with a couple of other things. Advocate for the care recipient. Being a strong advocate, especially in the healthcare system. I think we kind of touched on that before, but you need to be very respectful of that person. We don't want that care provider to not speak to them. They don't need to speak to you because you're their caregiver. It's still okay, and you want that. And you know, some people say, "Oh, you can talk to my mom. We were at the VA once with my dad, and the nurse was." Sometimes people feel like because you're elderly that you have hard of hearing, right? And sometimes people seem to treat you a little bit different, and that's felt by a lot of our elders. So be very respectful of them. And I think healthcare people are very respectful. But in this instance, this intake person was asking my dad in a very loud voice, "Mr. Martinez, do you smoke? Do you?" All these questions. And when she walked out, my dad said, "Why is she yelling at me?" She just figured you're an elder and you couldn't hear it. And so being respectful, but being an advocate for your person, call. Don't not call. Call. If they haven't called you back, you call. Because they have hundreds of other patients. You think, well, they said they'd call this afternoon, and it's now 2 days later. I just got a call from a doctor, a local doctor for the friend, and he said, "I'm so sorry that I hadn't called you back." Well, he knew that he hadn't called me back, but he was busy but be an advocate. Don't not feel like you can't call. Expressing your feelings, recognize the feelings of frustration, of sadness, of anger, of depression. Under normal circumstances, this can happen to all of us. And you don't mean it to be. You don't mean to be angry. You don't mean to be short, frustrated, but those are real feelings. And that's why, going back to the beginning, don't let go of everything that you do to be that caregiver, because you need time for yourself. But recognize those feelings. Talk to a friend, a relative, a counselor, a support group. I think even if you're online typing these feelings, I think it's more than, or keeping a journal. I used to keep a journal. And sometimes what I wrote in it wasn't funny. Later, I'd read it and it was funny. One time, one of the things, Clarence and I were at my mom and dad's, and it was Father's Day. So of course, Clarence was doing yard work, and we had I don't know, a meal outside, and I don't drink very often, but somehow I had a Mike's lemonade. So I had a couple of drinks, and then I went off to do something with my dad and with Clarence, and I turned around. My mom had never drank in her life. She was thoroughly enjoying that bottle of Mike's lemonade. I felt so guilty that, now she was little, like maybe 100 pounds. And so, she didn't drink, and I just let her have a bottle of alcohol. And I was annoyed with her. I'm like, what are you drinking? Why are you drinking? It wasn't her fault. I left it there, right? So there's a lot of things. So I wrote that in that night because I was frustrated with myself, and she drank it. It was funny later, just like it is today. Those are memories. Those are good memories. Recognizing the value of a caregiver is so important. If sometimes your person cannot say thank you, they don't know to say thank you. They don't know all the things that you're doing, and that is really hard on a caregiver. So if you know a caregiver, if it's your spouse that's there and maybe you're caring for a parent, make sure you thank each other. I used to say to Clarence, you know, it's my mom and dad, and he'd say, but we're in it together. And that would make me feel better. But I always felt like it was not his responsibility, it was my responsibility because they were my parents. But the role of a caregiver is a tough road, and we need to thank them. And I'm thanking you all right now for what you do, the kindness, the love, the patience that you do, and you do it every day, and you do it with a lot of dignity to your loved ones. So take that as a thank you, and know that some of your loved ones cannot express that to you. Just I used to have some caregivers would come in to visit with me about their person, and I'd say, and how are you doing? And tears just flowed. So that's what I wanted to share with you. 2 quick things. I'm going to put these over on that table. It's called the Caregiver Act. In 2016, the Caregiver Act was passed. It's a new law, and this law is what it is. Have most of you heard of this Caregiver Act? So hospitals, institutions are obligated to give the caregiver information on their loved one. If they're sending you home with instructions, they need to give those and make sure you're clear. We had our friend who was sent home with her husband's, he had a dog bite because he stuck his hand through the fence, and they sent her home with all this stuff. She's 89 years old. She didn't know how to change bandages. She was so frustrated, and he'd unwrap them with his dementia, and she'd wrap them up, and so just Wyoming Caregiver Act, it's just helping caregivers, but I'm going to put them over on that table, and you take a copy if you'd like. The other thing I wanted to share was I had a real favorite book. It's called The 10 Simple Solutions for Caregivers, Alzheimer's Disease, the 10 Absolutes. This book is really helpful, but I have some handouts that have a lot of what this has. So for example, never, never, never argue, always agree. How hard is that? How hard is that? It's very hard. But in the long run, it makes your life easier. So I didn't bring my glasses, but if you're talking to someone and arguing and you say something like, well, you know, your mother has been dead for years, you can't invite them to dinner. Now, if you're telling them that and they don't know, it's like the first time you're telling them that their mother has died, even if they're 80 years old. So instead, you might just say something like, I haven't seen your mother for a while. If I see her, I'll let you know you're asking about her. My mom used to ask me every morning when I'd wake her up, and she'd say, have you seen my dad? Does he know that I'm here? Because she didn't know where she was when she woke up. And I'd say, I haven't seen him, but let's get up and we'll talk about it. Because if I said that, she's 89 and I'm saying, your dad's dead. He doesn't know you're here. Why would I say that? But so there's things that really help. This is a really nice little book. I just wanted to share it. Do we have some of these? We will. But I'm going to put these over there, and I'm done. That's my presentation. One more quick little thing. I used to give these out to the caregivers. I used to just make these for people. This says, my family member has Alzheimer's. Please be patient. Your understanding is appreciated. If some people decided not to go out to dinner anymore because they were embarrassed, it was hard, they didn't know what to say to the waitress, you hand them this, and then that takes it off of you. You don't have to say, you don't have to do any of that. You can make up your own, whatever your person is, but if there's a little cognitive decline, that's very helpful. And that's all I have. And then I have another presenter, Clarence, is going to talk about what it's like he's my caregiver testimonial.
Well, my name is Clarence Montano. As Stella said, we've done caregiving for quite a while. During Stella's mom and dad's illnesses, we worked with them for probably about 10 years. During that time frame, most of the responsibilities kind of fell on Stella, but I hope I contributed quite a bit to it also. This go round, we're in the process of being involved with caregivers once again. This started actually about 5 years ago with some friends of ours. The friend, the wife had asked us if I would consider being a power of attorney for them. At that stage, it was very easy to say yes. You got into that role because there really wasn't going to be a lot of involvement at that stage. Over the last 5 years, however, things have changed quite dramatically. They're both of them, their cognitive condition has declined quite a bit. His mental capacity has diminished quite a bit. Their physical health has also decreased to the point that he needs nursing home placement, according to the physician. And then also the wife also needs some kind of rehab type, assisted living type services. And we're in the process of trying to look at that. But unfortunately, you know, in the last 5 years, we've sat down and talked quite a bit with them as to what were their needs and wants as they were getting a little older. During those 5 years, a lot of meetings occurred. Well, all those 5 years, I know what they wanted, but right now, I don't know what they need. You know, I think we have some idea based on what the doctor is saying. We're in the process of trying to deal with that at this stage, but things do change quite a bit. It switches quite a bit. We've been spending the last couple of months trying to figure out where are we going to go with this. You know, are we going to put them in a nursing home? We're going to put them in assisted living. It's the decision-making process has changed quite a bit. So when we first got started with this, unfortunately, they didn't have any family members close by that could take on some of this responsibility. So that kind of fell on Stella and I. Again, I kind of volunteered originally with the power of attorney and being a trustee for their will. But as things progressed, things changed quite dramatically. Now you're looking at, do we need to sell their house? Do we need to sell their vehicles to be able to pay for some of the long-term care? We need to look into the Medicare issues or Medicaid issues. There's just a lot of different things. So it has changed Stella and I's time frame for being able to do some things that we wanted to do. Our priorities have been shifted over. We do put a lot more priority on their care and their services. So if you're approached in regard to doing some of the things like being a trustee or a power of attorney, really take a look at it, because eventually that's going to change what you're going to be involved with. You know, it might be 2 years down the road, might be 5 years down the road. Ours happened to be about 5 years that I originally got appointed as their power of attorney, not thinking that it's going to come anytime soon, but it does come. So, so right now we've done a lot of different things that we did with Stella's mom and dad. I think, as Stella said, you need to know who your resources are or where your resources are. I'm going to tell you one of the key resources. I'm a little biased, but I think, I don't want to give her phone number out, but if you have questions on a lot of this type of stuff, call Stella. A couple days ago, I was kind of amazed. Someone called, you remember so-and-so that did so-and-so stuff? And she, oh, yes, I did. Do. She gave me the phone number. I don't know how she keeps track of some of those things, but she's a good resource. She's a very good resource for a lot of stuff. It disrupts my life a little bit. But anyway, I think you do need to know what your resources are. There's a lot of resources out there. Please take advantage of it. You know, take advantage of the hub, the synergy. There's the VA hospital system has a lot of resources. There's just a lot of different things that are out there that can help you navigate some of this journey of caregiving. But I think the other thing that you need to do is have some idea how to take care of yourself. As I think Stella said, you know, myself, I was getting a little burnt out when I was doing lawn care. But what Stella didn't tell you though, was I was taking care of 3 lawns, not 2. My father-in-law's neighbor had just had a stroke and got placed into a nursing home. So I volunteered to take care of his lawn also. So I was taking care of 3 different lawns. And after a while, you do get a little worn out. But I think caregiving is a tough job. I had some indirect responsibilities with it. I think Stella shouldered the biggest brunt of it with her parents. But I hope I was there to assist her in a lot of different things. But you need to be able to ask for help if you need it. Anyway, the caregiving journey is really a hard job. So I applaud you also. But any questions?
We've still got about 5 minutes for questions.
Yeah.
Hey, questions? Go ahead.
Person. Well,
Where's your wallet? Are we switching now? You really wanted to get out of this.
Share. Yeah.
So we can share. Okay, well, maybe there aren't any questions, but I will take questions. Yes, sir.
Wyoming independent.
Yeah. No, there isn't. I was just using 2 examples but it's here. I'll tell you where it's at. I actually have a number in my phone that I can give you before you leave. And, but they're the little, right across from the little strip mall on 5th Street, like where the Health Nuts at, across the street, there's Weaver Insurance and there's Wyoming Independent Living. But I'll give you the phone number and the name of a person and you can give them a call. They're very helpful. Yes. Don't forget that yes. You know that the senior center down there just started a little respite program. So I would start there with them, but Johnson County has a lot of the things that Sheridan does, but but let's say that you needed a specific item like a walker that maybe they didn't have in Johnson County, or maybe they don't have any. I think they do. Utilize the loan closet here in Sheridan. It is all suggested contribution. Their hours have changed, so they're not as convenient, but they're 12 to 4. You can always leave a message for Cliff, and he'll call you back. But utilize that. Utilize. Yes.
Then my question, I don't live in town. I'm caring for my parents in Claremont. So we're in Sheridan County. But just like her asking about Buffalo, I've reached out to our medical providers, start to try and find resources. But right now, no one's traveling the 42 miles. Any suggestions?
So we used to, but when I worked at the senior center, we did travel. And so I think that have you checked with any of the other agencies like Synergy, like Shelley Bourne? What is her? Mel's Helping Hands. They traveled too. And a lot of them do overnights. I just had a lady that I was with at the auxiliary board meeting, and her caregiver brought her to the auxiliary board meeting. And she said, I'll see you tonight. I'm spending the night with you. And she works for, Tracy's, I think it's just called Tracy's, out of Dayton. So there are organizations that do travel. I'm happy to give you a lot of those names,
I
but
know the medical team has reached out to them. We're going to start working on that, because I've reached out to Johnson County, because they're only 28 miles versus 42. So
right, but sometimes the county,
And Johnson County is no longer providing services out there.
I bet we can find
That's
something.
here. My other question is, there's 4 of us children, 3 brothers and myself, and 2 of them that live within a mile of me. How many times do I ask for help and then start looking for someone else? 75. I've been there.
So you know,
75, 76, 78 times, and not.
you know what?
I just become emotional, and then I get hated for it. I'll be emotional right now. I'm tired of being a saint, because I'm not a saint. I'm just a caregiver, and I need their help. And I don't know that they're ready or equipped, because they don't want to see mom and dad like this. I've now been living with them for 6 years. I've lived it. I'm breathing it. And as you can see, I'm tired.
You're tired. You know, would they help you with money? Would they help you with money? And I'm just saying this because then you can hire someone. Sometimes you hire someone privately. There are people out there that will do it privately. But there are people that do it with an organization. But I have to tell you that you need to know and find out how to do some of those background checks with the State Board of Nursing. People, when they say, I'm a CNA. Now, I can have been trained as a CNA, but I cannot claim I am a CNA unless I'm working under the State Board of Nursing rules. So if somebody lists on Facebook or wherever, social media, that they're a CNA, they are not a CNA unless they're working under a nurse. That's what it means, certified nursing assistant. But maybe your brothers, maybe just say, I'm really tired. Our parents need this. This is how much it costs. If I can get this much from you, this much from you, and this much from you, we can make this work. Maybe not include yourself in that finance because you're doing the other work. But you need a break. You need a break. Because if you don't take a break, health will make you take a break, right? We know that. So, not always are you going to have those family members. Some of them say, and there's someone in this room that I've known for a long time that gave up a lot of a job, a relationship to come and be a caregiver to someone. And the other siblings were probably busy, had lives of their own. And so you end up being that person. So you have to find some support for yourself. But they live in Claremont.
Yes.
If we can just talk, I'll share a name of some people out there, and they're both nurses, and they both care for their parents, and maybe you know who I'm talking about without using names. But I think they have found some resources. Okay. Need one more question before Susan comes up? I'm just kidding. Yes.
So being new to this caregiving hobby or so, my sister, one thing I've noticed when you go on the internet, right? There's all these tax breaks and all this financial help and everything, right? But then you go to the advocacy groups and the first thing they say is, well, talk to your accountant. So it's like, well, so does somebody give a class on that side of things? The tax incentive, the tax break, that could be a big help for people to have that information. If they're doing that at the hub or anything like that. There's always seems, money's a big part of this thing.
It is the big part.
And, it seems like it never gets really addressed head on. Or maybe I'm just missing.
Do you feel like if you, because we do have, we will have in one of our presentations, we have an attorney, we have she's not an accountant, what is Lori? Financial advisor, insurance, financial insurance advisor, and we have somebody that does Medicaid and Medicare. We're gonna have it as a,
Where they can show some of the things without having to make an appointment to pay them to get into your,
absolutely.
it's just things like, hey, everybody knows you have certain income tax credits that everybody knows about. Those are the type of things I don't need to, I feel like I shouldn't have to pay somebody every time I get an answer. So,
No, and if you want to talk to somebody about like Medicare, about Medicaid, there's somebody that does that at no cost to you. She's going to be one of our speakers. I'll just say her name. Her name is Nancy Drummond. She's going to be here, but we can give you that name and number before that, and you can. Okay,
That's good.
I would call her. So when we just have that 1 hour, we don't have that much time, but
Yeah.
I'll give you that number again if you don't have it, and come and see me. I'll just stand by up there, and because whoever I promise names and numbers, I'll give them to you.
Okay. Stella and Clarence, thank you very much.
You're welcome.
We'll see you here next week. Dinner's at 5:30, workshop at 6:30. We almost got done at 7:33. Thank you.
Thank you all for coming.